can set it up or hold it. You do whatever you want. So yeah, this would be good right here. All right, so when you're talking to patients and they're interested in the laser, all right, this is very important. So this laser right here, it's a class 4 laser. It's the highest quality laser in the highest class of lasers. All right, so class 4, robotic. It's literally the only robotic therapeutic laser in the city, in this part of in this Manhattan, Midtown, wherever we are. All right,
so
which
cool.
is huge, which is very important.
Yeah.
And I'm going to keep it that way. So robotic, deep tissue, laser therapy. All the laser's doing is it's the energy. All right, the energy from the light source of this laser that's interacting with the tissue, allowing the affected tissue to heal itself on its own. So the energy, what's it really doing? What the energy is doing, it's doing a couple different things. Blocking nerve pain. One wavelength is super pulsing on the nerve branches, blocking nerve pain. And then the other 2 wavelengths, increasing vasodilation. Superficially, also deep down. Okay?
Oh, okay. So like 3 wavelengths.
3 wavelengths.
Okay. And the 1 is like for the pain, and the 2 is the base dilation.
Exactly.
Superficially and deep.
Exactly.
Cool.
And the best thing about this is it's a pain-free treatment. All right?
Okay.
Your patients literally won't feel anything. It's non-invasive because we're going to do it from a distance about 6 to 8 inches away from the joint space. Okay? 6 to 8 inches for guys is hang 10 sign. For females, it's simply 2 hands together, 2 wrists together on top of each other. So pain-free, non-invasive, no drugs associated with it. The awesome thing is you'll start to hear and see patients reducing the amount of pain medication that they're taking and or eliminating it. All right? So non-invasive, there's no risk at all. Okay? There's no safety risk at all, except for if a patient were to stare at the lens of the laser without glasses. So patients always wear glasses. There's no downtime, meaning you don't have to wait before you leave. You don't have to have someone drive and drop you off. You're literally going to come here to the practice. The treatment time's 8, 10, 12 minutes, and then you're kind of in and out of the room within 20 minutes, and then that's it. We like to see the patients at least twice a week. Best case scenario would be 3 times a week.
Okay.
They don't need to see you. They really just need they're put on a separate laser schedule. They
Okay.
come in, get their treatments, and then they can leave.
Okay.
You can do whatever you want. You can include in chiropractic care, PT care, however, but they can also be standalone just laser patients. All right.
Okay.
So no downtime. There's no harmful side effects at all from laser. All right.
Okay.
Similar, unlike surgery or pain medications. The only adverse effect that you would ever get with laser is think about what the laser's doing. Additional blood flow, cellular energy, a treatment that a patient's never had before. It could cause stiffness or soreness. How do we know that? The next time the patient comes in for their next treatment, you're going to ask, how are you doing? Is the laser causing any improvement? Your patients are either going to say, I feel great, I didn't notice any changes, which is fine. I'll teach you in a second how we can help with that. Or the third thing is, this laser, this treatment caused me pain. And the pain is minimal stiffness or soreness. It's because of the additional blood flow. It's a treatment that they never had, so they're not used to it. And then what do you do in that scenario? Overall, time is the variable for the energy that we're delivering to the patient. So I'm going to treat you today at 10 minutes. You're going to come in on Thursday for your follow-up treatment. I'm going to ask you, what's your pain level? Hopefully it's going down. How are you doing? Is the laser causing any improvement? If the laser is causing improvement, then guess what? That same 10-minute treatment, that 10-minute treatment is, you're going to do the same thing. Why? Because that's the right amount of energy that's helping Mike Jenkins heal. Okay? If I tell you that there is no improvement, time is the variable for energy. So you're going to increase the time by 2 minutes. There's literally going to be a cheat sheet here, so you don't forget. So no improvement, you increase time. If this laser is causing pain, what do? You decrease time because you're decreasing the amount of energy. In theory, that should give the patient a good treatment with no stiffness or soreness.
Okay.
That's it. That's literally it. All we're doing is, it's similar to photosynthesis. You give a plant water and light, what happens? It grows. You take that same plant outside, inside, what happens? It starts to die. Those same photothermal, photomechanical processes we're doing here with the tissue in the body.
Okay.
All right, energy to the affected tissue to allow the tissue to heal itself on its own. It's cumulative in its effectiveness. You do 6 treatments for acute conditions, 12 treatments for chronic conditions.
Okay.
We'd like to see those patients at least twice a week.
Okay.
Best case scenario is 3 times a week. They do not need to see you after they've been enrolled into the program or the funnel or the laser patient population.
And is that like a patient like like continue to do it, or that's okay, or?
Ooh, sorry.
That's okay. Or-
Now, the nice thing about this is your patients are going to go through 6 or 12 treatments. And a lot of runners, tennis players, golfers, CrossFitters nowadays.
Okay.
Patients never stop working out. They never listen
Right,
to the doctor,
yeah,
right?
okay.
So what your patients are going to say is, I had a great experience with this. What do I do next? Majority of your patients will not come back for the same condition. All right,
Okay.
so you may treat something else. Hey, the laser worked great for my neck. Can you treat my foot? Kind of thing. But if you have those CrossFitters, those runners, those golfers, those patients that never stop, I would recommend either bi-weekly or monthly treatments. All right, you come in,
Okay.
you're on a separate schedule, right? You purchase 6 or 12 treatments up front. We'll bank those treatments here in the office. So if you're a runner and you start to feel that plantar fasciitis flare up, or you're a golfer and your back hurts or your elbow hurts, call us. If we have time on the schedule, we'll just put you on schedule.
Okay.
So you do an acute plan, a chronic plan, and then that's called a maintenance plan.
Okay.
You have to know how to talk about it. You need to offer it to your patients, because a lot of patients, they love the laser so much, and all we're doing is takes a year, right, for the tissue to heal itself on its own. Energy to tissue. Your tissue's like a sponge. It's going to soak up energy. It's going to elute over the 24, 48 hours. It's gradually getting you better over time. Laser's going to get you about 80% better. If you want to go on a maintenance plan, we'll help get you through that plateau up to 100%.
Okay.
All right. Common sense. If you offer it to everybody, and you have busy people that can afford the time and then can afford the cost of treatment, they should sign up for it.
Okay.
It completely makes sense.
Okay.
All right. You have buddies that are operating surgeons. Laser for post-op, immediate post-op,
All right, yeah.
reduction of pain, inflammation, edema, the trauma from the surgery, and then we can help the range of motion. And guess what? Helps patients get better faster.
Okay.
All right.